Hey there. Sorry about my face. I just woke up, so I'm just getting up and around. The pain in the overexpanded side and the pain that I feel in my back as a result of the overexpansion tends to get me up earlier than I would like to in the morning. It's like just laying on it is like it's a searing, it feels like it's just right by my spine. And so it wakes me up, and which is not a bad thing. Like, I can get up earlier and get some things done. But that is going to play into the not being able to go much bigger like I was hoping. So I do have one last appointment set up to meet with Laura and Dr. Ray as a possible, last expansion. And I'm just going to call this week. It's Sunday, so I'll give it a couple of days just to see if the pain goes down, but that's kind of what we were waiting for, was the pain to go down and see if we could go anymore. But I'll call them and cancel that appointment. Something kind of interesting that I did learn about the expanders was that they have a max capacity. I didn't realize that. I thought we could just keep going and that it was really up to the skin as far as like how big we could go. But when they did the initial surgery, they did put in a smaller expander. So these expanders that I currently have in are only 300 cc's. That's their max capacity. And when I spoke to Laura about it, she was like, you can overexpand, but really only like 50 to 100 cc's over the limit. And I'm already at 400 in the overexpanded side and 300 in the normal side. So since we have to keep that, like the difference between the two, then I'm really at about my limit anyway. Like I don't think I could go any bigger if I wanted to. So I don't know what they're trying to push for, what they're telling me anymore. But whatever. The expanders are full.
Hey guys, it's been a long time since I recorded anything, mainly because I just haven't had anything to talk about, nothing to update you all on. Everything's been pretty boring, on the level. I was doing my expansions and then I finished. I actually haven't had an expansion in a few weeks now. I was gonna go back in and try to get a little bit bigger size, but come to find out, I was already at my max capacity with my expanders. So I could have gone a little bit more, but I was already set up just to like be at the size that I'm currently at. As you can see, this is the size that is going to be. They will not be as perky as this, as my plastic surgeon has told me countless times. So I feel like he's warning me, like, hey, they're gonna fall a little bit, and that's fine. But this is the size. I wanted to shoot a quick update video for you all and let you know of some recent progress made, or some changes. The most recently, I made my appointment for my exchange surgery. So that is going to happen, let's see, March 23rd. That's almost 2 months from now. Almost. We're just into February, so it's going to be a little bit of a wait, and probably it is a lot longer than I have to wait. I really only needed to go 6 weeks after my last exchange, so if I had gone 6 weeks, I really could do my exchange surgery like in 2 weeks. But there's no rush for this. I'm just gonna wait, and I am having some pain in my left one. It's a little bit more expanded than the right one because it was overexpanded because we need the extra tissue, or my plastic surgeon needs the extra tissue when he goes to do the nipple reconstruction, because he needs extra skin to gather for the nipple. So it's overexpanded, and it does bother me. It is hurting. So I'm hoping that that pain goes down before my exchange surgery. And I also want to be mentally prepared for this surgery. My first one, my double mastectomy, was like drop and go. Like I really had to just barrel through it and didn't have any time to mentally prepare for it. And I feel like, you know, after the fact, I had to grapple with some very serious psychological realizations and realities of what I had done and of what I had just gone through. So with this one, I've got a couple of months. I can just settle into it and really get ready for it. And I'm glad that I get to look forward to this, because of these videos. You know, I look back at my my original surgery video, and I wish, I watch it and wish that I had gotten so much more, you know, just more information. It's fascinating to me. It's a fascinating process. And I would be curious as a watcher, like, you know, more, what more goes into it, and seeing more of inside the hospital and my experience in there. So I wish I'd gotten more. And, you know, this time through, it's a much smaller procedure than the double mastectomy is. My plastic surgeon told me that it only takes like an hour or two to do the swap. It's just taking out the expander and putting in the implant. So it really does not take that long. So I will be getting more of that. And then about 2 months after that surgery, I'll be going back in for my final surgery, which is the nipple reconstruction. As you know, if you've seen my previous videos, this side is fine. It's absolutely normal. It has the nipple. This side is not. It's blank. Well, there's a line through it because that's where my scar is, because they took my nipple because that's where the cancer was. So once that is done, then I will be all back together. Kristen, all back together. So just real quick, I wanted to call attention to something. I did see a video recently of a young lady who was actually 32, I think just a year younger than I am, who was going through the same situation. And she had done an interesting video and had called attention to this, and I'd never thought to tell you guys about it, but she did, and I found it fascinating, so I want to do the same. Because of my expander, I have, I'm cording, which is like, because it's so hard, it's pressing against the skin, and it's just so, if you can see it, it's so unnatural. But I've got like this just hard, like this tendon going from my chest to my shoulder, and it makes it absolutely impossible to shave in there. It's like concave in there, and it is on both sides. The only other time of my life that I ever remember my body doing this actually was I lost a lot of weight years ago, and I had lost so much weight so fast that there was just no fat here, and so it was doing this exact same thing. And I remember at the time not being able to shave because my armpit was so, like, it was just sucked up under there. So anyway, I just wanted to show you that. That's kind of just one part of having expanders, is the cording of the tendons. And another thing I wanted to call attention to, and this lady was having the exact same problem, was, I don't know if you're going to be able to see it. I'll try to show you here. The way my expanders are set, one is actually higher than the other. So as I'm walking around day to day, God forbid I wear a tight shirt, my boobs are unlevel. This guy is higher than this guy, and the bottom is the same. Look. Oh my gosh. So I see a big difference. my plastic surgeon says not to worry, that once he gets in there and he can deal with the scar tissue that's forming on both sides, and he can level them out, he's going to level them out. I'm a little worried because I watched this lady's after video after her exchange surgery, and it was 2 or 3 months after her exchange surgery, and she was still really unlevel, super duper unlevel. So, I don't know. I'll let you know how it goes, I guess. I feel like if they're not, level by the end of all of this, I don't really know where to go from there. I don't know who to talk to. I don't know how to get them level again, because, the doctor did their job, and insurance paid their part, and that would be the end of it. So I don't know if getting them perfect is part of the whole insurance covers, this procedure thing. So, yeah, I don't know. I guess that's too far in advance to really worry about at this point. So I'll let you know. I'll let you know how it goes. All right. So that's it. Bye.